Hello and welcome to Maternal Mental Health Awareness Week. My name is Eve Canavan, one of the co-founders of the week. And this year we're marking 10 years of the Awareness Week with our theme, A Decade of Voices. And with that in mind, for today's information session, I'm joined by our friend Dr. Alex, where we're going to talk about the 6-week check and what you should expect to happen at it. Hello.
Hi, thank you for having me.
Oh, no, we are delighted to have you. Every year we love to have a GP on to talk to them about going to see your GP and perinatal mental health. And when we had our pre-talk, I was talking about how I followed you and how I really love your combination on your Instagram page of you as a parent, and a parent who is a GP. And then you talk so openly in particular about perinatal mental health. And I think you're so engaging. And we couldn't think of anyone better when we looked through our survey results for this year, which is when, so I emailed Dr. Alex to say, will you help us out this year? When we
Yeah.
looked at our survey results, loads of it was like, what's the 6-week check? Does the 6-week check still exist? Should I be having a 6-week check? Is it about the baby?
Yeah.
And I thought, Dr. Alex has done something on this on her Instagram, which you
Perfect.
ask you to help us.
Yeah, perfect. Thank you so much. No, I'm really glad to be here. So I'm happy to talk about it. I think it's really useful. I think there's a lot of confusion about it. So yeah, and that's why I talk
Lovely.
about things like that on my page. So yeah.
Oh, well, I'm so pleased. So we'll launch into a chat in just a minute and we'll introduce Dr. Alex to you. But before we do that, this is the disclaimer that we put at the start of all of our information sessions, and this is particularly pertinent even though Dr. Alex is a healthcare professional. This conversation between me and Dr. Alex today should not replace any individual information you have received from your own healthcare professional. And Dr. Alex is not available to answer any of your personal inquiries about perinatal mental illness. Please direct them to your relevant healthcare professional. And with that in mind, Dr. Alex, give a bit of an introduction to yourself. Who are you and what do you do?
Thank you. So my name's Dr. Alex. I am a GP working in Southeast London, and I'm also a mum to 2-year-old twin boys. Yeah, as you said before, I post on my Instagram about the life of a GP and also the life of a twin mum, which is complete chaos and the kind of the kind of weird relationship between the two things. So yeah, that's what to expect on my page.
And it is really relatable. I think the chat just before we press record on this, I was going to Alex, oh, my son, oh, illness. And I think what is so nice is seeing, for me, speaking really frankly, was seeing the connection between you being a doctor and a parent and talking about struggles.
Yeah.
And I think so often the reason we do these sessions and we try to keep them as informative as possible is that so often, and I remember when I was poorly myself after having Joe,
Mm.
the fear of going to the doctor and not knowing what to say or what to expect, or feeling like it's a bit of an alien world. And I think it's
Mm.
so lovely when you have a GP such as yourself who gives a little insight into your own reality,
Oh
the
yeah.
little insight to, and also being a parent to twins, which is very demanding, but talking about
Mm.
perinatal mental health so openly. And I think
Mm.
that's why you were a really good choice for this, because I think you have your Instagram page shows this really good combination of actually this is what goes on in the medical profession if you come to us and you're not feeling very
Mm.
well while pregnant or you've had a baby. But
Mhm.
actually I get it as well because I've had a couple of kids who are young, I'm just
Mm.
after that postpartum period, and you talk about
Yeah.
your own experiences, which I think is it was really enlightening, and it's really nice to see, so thank you.
Yeah, yeah. No, thank you for saying that. I think yeah, I do talk about, my own struggles with mental health and postpartum and things like that. So, yeah, I think it's really important to just have these conversations and normalize it. And yeah, that's why I do it. So, yeah.
Lovely. Right. Well, let's get into it because we've talked
Yeah.
about this in the past. The 6-week check.
Yeah.
Everyone's heard of it. My kid's 16. When I had my 6-week check with Joe, I wasn't asked at all what I felt like.
Really.
Even though I had, like, my 6-week check came about 12 weeks and I'd just come out of mother and baby unit. But no, they just kind of checked over Joe, washed their hands and kind of went by. And I can still remember going,
Oh no.
oh, so what is the 6-week check? Is it still a thing that's supposed to happen after you have a baby? And what's supposed to happen at it?
Yeah.
Help.
Yeah, very good question. And I'm sorry that you had that experience. You should not have had that at all. Um, yeah, I think it's definitely still a thing, and it's definitely something that every woman should have. I think about it. So with the 6 week check, obviously you do tend to have mum and baby have their appointments at the same time, but they should be separate appointments. So mum has an appointment for herself and baby or babies have appointments for themselves, as it was in my case. um, but yeah, so in terms of what it should include, it should include, I like to think of sort of four main points. So it should be covering your physical health, your mental health, pelvic health, and family planning. And I can talk about those in more detail if that helps.
Yeah, that'd be lovely. Because I was going to say, how do you make it the focus of the mum in the mum session? Because I think
Yeah.
people at home would be surprised that they should be separate appointments. But
Hmm.
before we just go into that, one of the
Yeah.
questions that we had come through on the survey, it came through a couple of times actually, and
Hmm.
I think I said this to you in our pre-talk. People were saying, am I supposed to book my 6 week check, or will someone from the GP surgery say to me, hello, you had a baby 6 weeks ago, you should be having one? Like, should you, as a parent, are we responsible for booking our 6 week check, or should we be getting a nudge from the doctor's surgery?
Yeah, that's a good question. I think it probably varies with
Okay,
practices. Your discharge notes should obviously go to your GP, so they should be kind of aware. But you also need to register your baby when they're born with the GP. So I think once you've done that, your GP should then be aware that you're needing to book an appointment. But I would say it's probably worth being proactive and book the
sure.
appointment yourself. Yeah, just to make sure. And it should be around about 6 to 8 weeks. It's even if it's a few weeks later, it's okay. But around that time, and it's supposed to sort of tie in quite nicely because obviously the baby needs to have a check at that time, and they also usually have their first immunizations at around 8 weeks as well. So it's kind of the idea of making it a time where you can do all of those things in one, so you're not having to come and go so many times.
Lovely. Thank you for that. And so I think, yeah, let's move on to the part about the focus being on the mum
Yeah,
doing it and the four things that you talked about. So let's delve into them a little bit more if you can.
yeah, yeah, for sure. So yeah, when I do the 6 week check, and I think it's sort of generally a format. I mean, you only really have a one appointment time slot. So usually that's around about 12 minutes. It can be 15 minutes, it can be 10 minutes. So there's quite a lot to cover in that appointment. So those four things that I mentioned, so physical health, mental health, pelvic health, and family planning. So physical health, your GP will be asking you, or should be asking you, about your pregnancy. First of all, how was the pregnancy? Did you have any health problems, for example, gestational diabetes, high blood pressure, things like that, or if you already have any existing health conditions? And then also about the birth and what type of birth you had, and were there any complications surrounding the birth as well. So particularly, I think that's a good opportunity to ask about birth trauma. So that's something that we do see a lot, and I think that's a good point to ask about there. And then any kind of postnatal complications. So I've talked a little bit about some of mine on my Instagram, but for example, if you have any tears, any high blood pressure, again, any diabetes, any ongoing health issues. Um, and then I also tend to try and ask a bit about waterworks, so bladder, and also bowels. So if you're constipated, because that can be quite common after birth, whether you've had, particularly with cesarean birth, but also with sort of vaginal birth as well. And then mental health. So always your GP should be asking you about your mood, how you're feeling, if you're feeling low in mood, if you've had any symptoms of anxiety, asking about sleep. So obviously, when you've got a newborn, your sleep is probably going to be disrupted, which is normal. But particularly, how are you sleeping when you're able to sleep? So once baby's settled, are you then sort of lying awake, unable to sleep, unable to relax, racing thoughts, waking up early, that sort of thing are all key things to look out for. And also ask about how you're feeling at home. Are you feeling well supported at home? Do you have a partner, any other family or friends that are supporting you? And I also use this time to ask, if we can try to make this sort of a discreet way of asking about any issues with domestic violence as well. So I would always try to do that in a way that was safe for mum. So whether that was having mum on her own, for example, in the room. And then coming on to pelvic health. So by around 6 weeks, your bleeding should be stopping or should have stopped. And then so you're asking about periods after they come back. It's a good time to also remind mums about their pelvic floor exercises. So just trying to fit that in, maybe giving some information on that if mums are not aware. I'm not going to lie, it's something that I often forget to do myself, but it's good time to remind about pelvic floor because that's really important after birth. And then I also check on when the mum's smear test was, so whether they recently had one, was how long ago was it? Are they due one? Sometimes if you were due one during pregnancy, you will then delay that until after birth. So you need to wait until about 3 months after birth before you can have the smear test. And then also any pelvic wounds. So if you've had any tears or if there were any issues or particularly as well, looking at the cesarean section scar is a good time for that as well. And then family planning. So asking about contraception, whether or not mum wants to start any contraception or not is fine, but just making sure that she's aware. So after 3 weeks after birth, you are then potentially ovulating again, whether or not you're breastfeeding. And it's a good time, if you're not planning another pregnancy anytime soon, to just make sure you're starting something that's safe to use, because there are guidelines on what you can and can't use straight away. And also I ask in that sort of segment about any issues with sort of sexual function, how mum's feeling. If they're not feeling that they want to do that, that's fine. But are there any issues there, or is she experiencing any pain with sex or anything that is kind of uncomfortable, or any kind of concerns there? So I would always ask about that as well. And then if the GP needs to examine you, it's usually things like looking at your wound. If you've got a cesarean, it should be healing well by then, but just to make sure. And then also a pelvic or abdominal examination if there are any symptoms surrounding that. So that's the kind of basic, and I would say a good, thorough GP 6-week check.
And I think that's so helpful to go through, because I think we often hear, well, you hear it when you become a parent. And I think if you go on any parenting forum at any point throughout the day, if you were to look at one right now, there are always things around, do I need contraception because I'm breastfeeding? No, I don't need contraception. The only one I've got is fear and exhaustion. I was looking at Hannah Reid's
Yeah, for
Instagram
sure.
the other day, but, and I think, so, and, it is this thing of, what can I ask when I go to my 6-week check? We get a lot of questions like that. What questions am I allowed to ask? Is there a script the doctor goes through? Can I bring things up if I want to? And I think you going through those 4 areas, so actually this is the space where these things can be talked about. I think the fact that you talk about it being a safe space to bring things up, such as around domestic violence. Definitely we know in some scenarios people will say that they go to their doctor's appointment with a family member, and actually
Yeah.
they feel they can't speak out. So actually, this thing's here so that, the doctor might ask to see you on your own, to ask you, certain questions, so you've got a safe space so that you're able to. So I
Yeah.
think it's really helpful that there's that overview, Alex, because I think we often say go to your doctor and talk about these things, and people say, where is my space for it? And then the question in the newborn world is, can I ask these questions at my 6-week check if I get one? And I think showing those 4 indicators show that actually, one of your questions will fall within one of these, and this is your space, to
Yeah.
ask it. And I think one of the things that we've talked about before, which I thought, and I asked you about this question, was when people come particularly to talk about how they're feeling after having a baby, and they are struggling with what to say. So Dr. Alex gave me some really good insight into when people go to a doctor, and I've been guilty of this, having been signed off work previously with being overwhelmed with work. When you're burnt out with work, I definitely didn't go to the doctor and say, I'm burnt out. I went to the doctor and went, oh, it just all feels like too much. And so I was saying to Alex,
Yeah.
are there any kind of keywords, code words, things people could say if they're struggling to find the words to say, I've had a baby and I don't think I'm feeling great mentally? And often, sometimes people don't even realize they're struggling mentally, but they just don't feel like themselves. Are
Yeah.
there any keywords or code words people could say to you, so as a doctor you get the idea? Or are there certain things sometimes doctors ask to try and take that information from people? Do you see what I'm
Yeah,
saying?
yeah, good question. Yeah, so I think that's really important because often, like you say, people might not really realize that they're struggling, or they might not have the words, or they might not feel like they know what to say. Everyone's different in terms of cultural background and family background and what they feel comfortable with talking about. So a lot of the time maybe we don't have the right words, but I think that's okay. And your doctor should also be really looking for signs and asking questions. Sometimes you might not maybe understand why they're asking the questions, but I think I did sort of see once someone taking offense to the question of how are you? Are you okay? Are you struggling? But maybe that was just a more direct way of asking the question rather than your GP is trying to sort of pick up on this really. So I think if you're struggling to get the right words out, just bringing it back to something really simple and not being afraid to say the words. I've written down a few things that I think could be useful. So just saying things like, I feel overwhelmed, I don't feel like myself, I feel like I'm not coping, or even just describing your mood. So I feel really sad, I feel really low. A lot of the time with sort of postnatal depression or postnatal mental health struggles, you may not necessarily feel particularly tearful or sad. It might be a feeling of numbness or just kind of emptiness. So even just saying those words, I feel a bit numb, I feel just not quite right. And then that's an opportunity for your GP to ask more questions. Even just saying things like, I feel exhausted all the time. These are the sorts of things that we do here, which I think are signposts within a consultation to ask more. So hopefully that sort of gives a good way for mums to sort of think of things to say. I think one other thing I wrote down in this with this question was, I think sometimes you feel, or mums might feel scared to say things like they are struggling with bonding with their baby, or that they're having those kind of thoughts where they worry that if they say that, it means that, that professional might look at them like, oh, they're not doing it right, or do we need to be worried about the child here or the child's safety? And that's not the case. It's actually really common to experience that feeling when you're experiencing postnatal mental health difficulties. So I think it's okay to talk about that. And obviously, if you are having more sort of dark thoughts, intrusive thoughts, suicidal thoughts, always bring that up as well. But I appreciate that is difficult, and your GP will probably directly ask you about that as well. Hopefully they'll ask it in a sensitive way, so that you're not sort of just taken aback by the question.
And I think that's so helpful to say. And I think it's something that
Yeah.
we cover every year, but it's something that we can't ever say enough, Dr. Alex, because there is
Mm.
that thing of, we always say, if you speak up and you talk frankly about, the at times very dark and very frightening, thoughts that can go through your head, or feelings.
Mm.
To be honest means that, your correct treatment plan can be sorted out for you. But it is really hard to be honest when actually your own your own brain and the words are scaring you. So, and
Mm.
I think one of the things that I've definitely learned from your page and from my own experience, but I think one of the reasons I like your page is that you talk so openly about these things, is that kind of verbalizing them gives them less power. And
Mhm.
sharing them means that you're sharing them with other people. It's not all on you. And I think one of the things I was just going to say is that there's a couple of charities, well, there's three charities actually, that have symptom checkers where you can write down how you're feeling and hand it to your doctor. So
Mhm.
Smile Group do it,
Mhm.
Pandas do it, and the Maternal Mental Health Alliance have one as well. So you can just write down how you're feeling, like weird thoughts, thoughts about harm, thoughts about doing things to myself or my baby,
Yeah.
sexual intrusive thoughts, those kind
Yeah.
of things. If you can't say it, like hand it to your doctor,
Yeah.
to,
That's so
to
helpful.
read.
Yeah,
Yeah,
definitely. And
absolutely.
if people come in, if they've written things down or written a list, that's fine. Or they might want me to read it or look at something on their phone that they've written down. That's absolutely fine. Or even just saying, I find this really difficult to talk about. I'm struggling to talk about this, but it's really important. I think that is then a kind of key, the GP needs to will switch on at that point and think, okay, this is something that we need to pay attention to.
And I think as a GP, you've heard this before, haven't you?
Oh, absolutely, all the time. I mean, I do the 6 to 8 week checks very regularly, and I really enjoy doing them because I love seeing mums and babies. But yeah, I see all these kinds of things. It's rare that we'll have just a normal. I say it's rare. We do often have a consultation where everything is kind of normal, and everything goes very quickly because there aren't any concerns. But more often than not, there are multiple things that we need to talk about. So that's why it is difficult to get it all done in one go. But yeah, we see it
And
a lot.
And I think that's so important for you to say, because I think we know the big reason that people don't want to talk out is that they are scared that if they say to their GP, I'm having these thoughts, I don't feel like this, I don't feel like I'm bonding with my baby, that social services will come in and sweep their baby away.
Yeah. Yeah, and I can understand that being a fear, but it's definitely that we're trying to, as you said, make sure that we're going to sort of treat the right problem. How severe in terms of unwellness is the mum, that we need to offer the right kind of support and make sure that she's not going away without the right care that she needs.
And so what does treatment look like? So we always say to people, recovery absolutely is possible. That's why the week's here. It was born from lived experience of being very poorly to being better. Someone comes to their GP and talks to them, as we've talked about today. They've listened to this and thought, Dr. Alex has given me the confidence to go and talk to my GP to say I'm not feeling quite right. What can treatment options look like? What can the GP offer?
Yeah, good question. So obviously there are the options for medications for treating various different mental health conditions. I can talk about that in more detail, but it's not just medication. So, and actually, the sort of first line in terms of the NICE guidance is to offer talking therapy. So whether that's cognitive behavioural therapy, so CBT, psychotherapy, or I guess a referral to group therapy. And then alongside that, we offer medication depending on what the mum wants, but also what we feel together would be the right thing, whether it's something that the mum would need and want. Um, and if medication is chosen, and even if it's not, I would always do a follow-up appointment at around 2 to 4 weeks after that. So whether that's a telephone appointment or a face-to-face appointment, just to see how they're going with the medication and how they're going with the if they've had the talking therapy by that point, which it depends on the services that they're accessing that through. The other options are, so depending on the severity of illness, if mum is needing more support, then we do refer to the perinatal mental health team as well. And they are brilliant. They include mental health nurses, psychiatrists. They often have as well access to sort of group therapy and community groups. So, for example, a walking parent group. So you take your baby with you, and it's lots of mums going along, having a chat, and just really having that chance to support each other as well, and building those relationships, which can be really difficult postpartum because you can be quite isolated. And then obviously, if it's needing sort of more intensive support, then sometimes it will be inpatient care, so mum and baby units, or there are sort of community mental health teams as well. I guess the perinatal mental health team that could do sort of a hospital at home type setup. But that really depends on the illness and what support you need.
Thank you. And I think it's so good that you've talked about the other options that are available, and I think if people look through our pages during the Awareness Week, we've done
Mm.
lots of work with perinatal mental health teams where they talk about what happens if you're referred to them,
Mhm.
and what happens. We've also done we've done walks around mother and baby units. So if you are referred to a specialist
Mhm.
inpatient treatment, such as I was in the mother and baby unit.
Mhm.
We've done a couple of walk rounds on MBU so people can see what they're like, to demystify them a bit, because there is so much more support there than there was 16, 20 years ago. We have
Yeah.
so many trained up people in the perinatal mental health world now who have great links into GP surgeries, which is why we wanted to talk to you, Dr. Alex, to talk about like
Yeah.
the relationship and how you refer on, and the
Yeah.
relationship. And I think it's so important to show your treatment options. There are so many. Everyone's journey to recovery is individual, but there's lots of different things to help. We publish some stuff around this from the breastfeeding network in the week, so I won't expect you to
Mm.
spend a lot of time on this at all, but I just wanted to flip up, um and don't think you need to listen here at all like that. However, but there is still the line that people think you can't take antidepressants while you're breastfeeding. Is that
Mm.
true or not true, Dr. Alex?
Yeah, it's not true. I mean, there's lots of different medications, and certainly we do prescribe medications like, for example, sertraline, which can also be taken during pregnancy as well, and safe to use during breastfeeding. And your GP will never prescribe you something that's not safe for breastfeeding if you're breastfeeding, or even if you're not breastfeeding, most likely, or doing combination feeding. Um, So yeah, that's definitely, there are options for that.
Okay.
Yeah.
Thank you. I wanted to get that out there. And I said there's so
Yeah.
much information out there, and the Breastfeeding Network do some fantastic fact sheets on it. I know that GPs have information on this when you go to them, but I wanted to have it within this
Yeah.
talk so people can go, okay, okay, I
You
might be
can.
able to go and have an option
Yeah,
there. One thing I
absolutely.
wanted to end on is, and I
Yeah.
think this is the thing which a lot of people speak about when you have a baby and you're bonkers tired, like you've talked about before, like and the days merge into nights, nights merge into days, and you don't know what's going on here, there, and everywhere, and you go, I'm not feeling myself. And sometimes people go, oh, it's just the hormones. Like,
Oh, yeah, yeah.
at what point is it just the hormones, baby blues, all a
Yeah.
bit bananas? And at what point do you need to go, hang on, I think I might need to go and see my doctor? Does
Yeah,
that make
yeah.
sense?
Yeah, definitely. That's a really important question. And I think it's almost the baby blues is almost in some ways a little bit of a, I don't know, I worry about that phrase a little bit because I think
Yeah.
it can be sort of slightly misinterpreted if you are struggling postnatally. And the important thing to look at with baby blues is that it's meant to sort of describe the emotional sort of response when you have that sort of hormonal drop after birth, and that can go on for maybe a week, or it's usually a few days, to be honest. And I think anything beyond sort of 2 weeks, 1 to 2 weeks, let's say, if you're then noticing that you're struggling, then I would say that's more. Yeah, so that's an important distinction, definitely. Yeah,
Lovely. And people don't have to wait till the 6 week check to go see the doctor. They should book an appointment then.
definitely. Yeah, and I think if you're, yeah, if you're feeling like you're struggling sooner than 6 weeks, for sure, book an appointment. But I think it's important to also note that it's not just the 6 week check that would pick up on that. And a lot of people will then, even in the first year, if they're struggling, then it's not that you only have to go at that time. So if you're feeling actually okay in the first maybe 2-3 months and then things start to worsen, then that's still postnatal sort of mental health. So we would, even up to a year, we would still sort of class that as struggles related to postpartum.
Thank you. I think that's
Yeah.
really important. I think we definitely hear, well, I think we hear it from our own experiences, but
Mm,
the survey and things that you see on comment sections throughout the year of people saying, when can I go? What can I say? People don't want to take up GP's time. They know your time is
mm,
precious, but this is a space to say, actually, you are valid. You've had your baby, you are important. It is okay to book a GP's appointment, to go and see
yeah,
your equivalent of Dr. Alex to say, I'm not feeling very well. And I think ending this to say that actually with the right support and help, which your GP can help provide, that recovery is massively possible,
definitely,
and that you will get better. Dr. Alice,
definitely.
I have just found this so lovely. I think this is going to be a really insightful and kind conversation for people to listen to and
Oh, that's good
refer
to
back to. And I just think you're such a shining light in this community, whereas you
thank
are
you.
so open and you've given your time so graciously to talk to us, and you've just been so lovely. And you've
Oh,
answered, well, you've answered all the questions that we've put together from the survey. So I go through and I think, right, what should we ask? What do people want to know?
thank you.
Well, it's just so important, and you've given your
Yeah.
time, and I know you're a tired mum as well. So I wanted to say thank you
Oh,
so much. So
you're very welcome. I feel like we could talk all day. It's been great. Thank you so
we
much.
could do, but I am so pleased we could bring you into Year 10 of the Awareness Week, and a huge thank you for the work that you do in this space.
I am absolutely privileged. Thank you. Thank you for having me.
Thank you. See you later. Bye bye.
Bye. Bye.